look at this amazing space. This is Dr. Preema London, the clinic of Dr. Preema Vig, and I have come to meet her, have a look around at all the treatments she offers. Dr. Preema is a leading aesthetic practitioner who has been refining her skills since 2003. And what we are particularly going to concentrate on today is the body suite. She's a dab hand at doing facial treatments, but she's a real expert on body honing too. So there are machines that can freeze fat, bust cellulite, tighten the skin, all of that. And we're going to go through those. And then I'm going to have a tweakment, a body tweakment of some sort, which I'll leave to Dr. Preema to decide. So come with me and I'll show you what's going on here. I just wanted to ask why you have so many body treatments here. What got you into all that?
So over the years, since 2003, we've grown slowly and steadily. However, I have a lot of patients who've been with me for a very long time. Wow. And they trust me not to do anything unnecessary. Sure. And they also have been asking over the years, what can you do for my body? What about my skin here? And what about this? And we're all getting older, little by little. And it was just one device at a time, slowly and steadily. Okay. Probably from 2014, actually.
You know, I think this is really interesting because, you know, they absolutely trust you with their faces, like you say, and so that they absolutely trust you with their bodies and to make the decisions and lead them in the right way. Preema, this is your main treatment room, isn't it? And what kind of things do you do in here?
So I do all the injectables. I oversee the body suite.
Let's go and have a look at the body suite, because you've got lots of rooms down here, haven't you? I mean, this clinic is huge. I love Dr. Preema's before and afters book because these are real people. This is a body sculpting technology, MSculpt, and you can see, even on a slim person, the difference that it makes. And here's somebody else you might think, what does she need to do? But you can just see the fat busting and muscle tightening that's gone on here. This is fat freezing on real people. You can see the way it's brought down the volume of fat there. The nice consistent pictures, MSculpt. I recognise that bottom, that might be mine. Okay, so in your body suite, this is the first of your body rooms, isn't it? And I can see we've got cool sculpting, 2 machines.
Absolutely.
For faster treatment. Okay.
2 sides at one time.
Wow, okay. And that is for bringing down areas of fat that aren't responding to diet and exercise.
Absolutely.
Really, isn't it? Okay.
As long as someone's got a decent lifestyle.
Okay.
And it's all about making sure we get those stubborn areas of fat and reduce them.
And which are the most popular areas that people go for, or does it just completely depend? The stomach?
Stomach,
yeah.
And flanks.
Flanks, okay.
Bra rolls are getting quite popular now.
Wow,
Or the little bra fat
you can
here.
deal with all these different bits, can't you?
Because we have the different applicators sizes.
Sure. And thighs, inner thighs?
Inner thighs, outer thighs.
Okay. So,
arms.
So people might come in and be hooked up to that on both sides and do a couple of cycles of treatment?
Absolutely, yeah.
Right,
But
okay.
I've got patients who come in literally for the whole day.
Wow.
And just go through whatever they need.
Yeah. And just settle down with an iPad or something. And
Netflix.
Netflix.
Yeah, absolutely.
I hadn't seen the screen.
Yeah.
And now this is another kind of technology, secret RF. Now I know of secret RF. This is radio frequency microneedling.
Absolutely.
I know of this for the face.
This
How
does
do you
the
use
body
it
as well.
on the body? So where do you use it on the body?
Anywhere.
Okay.
Anywhere.
Tell me, what does Venus Legacy do?
So it actually works on faces and bodies.
Okay.
Skin tightening with no downtime, but also cellulite reduction as well.
Wow, because this is radio frequency as well, isn't it? But done in a slightly different way. When somebody's got this here, it means they're serious about taking the pictures properly, because with this plaque on the floor for the photos, it means you get consistent pictures, because I'm going to stand with both my feet at 1, and then at 2, and then at 3, and this way you get everybody to have pictures taken against a clean background, and you can make sure that your after pictures are going to be completely consistent with the before. Ooh, MSculpt or EMSculpt, do you say it? EMSculpt?
Yes, absolutely.
Tell me about the EMSculpt.
So EMSculpt is electromagnetic energies.
Yes.
Muscle sculpting.
puts like 20,000 crunches through in half an hour. Is that
Absolutely.
right? Yeah.
Absolutely.
So it's quite overwhelming as
Yeah.
a feeling. And the stomach version actually can reduce fat as well.
Yes, it can.
But
It's a
not
different
the- Okay.
It's a different protocol for the energies being submitted for the abdomen in comparison to the bottom, because you don't want to dissolve fat. You don't want to get rid of fat on the bottom.
No, we
You
all want
an
as much fat there as
uplift.
possible, don't we?
Yes.
And True Sculpt Flex, now this is slightly different. Can you remind me of how it's different?
So with the MSculpt, you have two pedals. Also, we do treat arms, biceps, triceps, and we've got different applicators for that, and the
Okay.
calf muscles as well. But with True Sculpt Flex, we have about 16 different smaller paddles, as you can see.
Okay, yeah, these ones.
And so we can really target different areas, electrical stimulation, and there is 54,000 crunches in a 45-minute session.
It's a really bizarre sensation because you have your muscles kind of twitching
Yes.
independently.
And you can see it
Yeah.
right in front of you.
Not comfortable, but
However, it's tickly as well. It's a bizarre sensation.
Yeah.
And you can tailor make it to any part. So if somebody's got weakness on one side,
Yeah.
you could actually treat the thigh, the calf, depending on anywhere.
Yeah.
So I had two areas done. So I had the buttocks done, but also
yeah.
the upper part here.
Okay.
So the lift that I got was amazing.
Yeah.
It was
Wow.
amazing. This is another cellulite
Another
device.
cellular.
Yeah.
Oh, tell me, is this the M-tone?
Yes.
Yeah, right.
Yes.
How does that work?
By BTL, and it has radio frequency with shock waves.
Wow.
So
Okay.
we're getting really good results.
Okay,
with
this
that.
is one I don't know and I haven't tried.
Yeah.
Amazing.
So great for legs, great for thighs.
How do you help a patient decide which of these they should go for if they come in and say, Dr. Preema, help?
It depends on what their concern is.
Okay.
So if somebody has cellulite,
Yeah.
then it would either be usually our M-tone, and sometimes
Yeah.
people would opt for a bit of the venous legacy as well.
Okay.
So we can actually do combination treatments as
Yeah,
well.
sure.
And if it's purely if somebody wants their buttocks to be lifted
Yeah.
or abs to show through, or if they want a little bit of fat to be reduced, Sculpt. Now
Okay.
we're combining
Yeah.
our treatments.
Sure, I suppose that's the beauty
Which
of
is
it, isn't
good.
it? You can
Yeah.
use your skill and judgment to say, look, this will give you this kind of result.
And the other thing about these devices, chronic back pain
Really?
helps with back pain.
How does that help?
Strengthening all the muscles around it.
Okay, sure.
Core stability.
Yeah. The one thing I haven't asked you about body treatment wise is Profhilo, because I mean, we know Profhilo is a facial injectable, but you use it on the body too, don't you?
Absolutely. But now they have brought out Body Profhilo. Or
Okay.
Profhilo Body, I should say.
Yeah.
And it is a bigger syringe.
Okay.
So the areas of treatment, it can be anywhere.
Right.
However, a great treatment for this inner part of the arms, which starts to go
okay.
as we get older, and also tummies as well.
Right. So how are you going to?
So, I was thinking, let's have a look at your arms here. Lovely. So see this?
Okay.
It's going to help with, so it's literally
All
going to
soft.
be this area.
And what it might do would be tighten it. Fantastic.
It's great for
because
skin
I can
laxity, 'cause you've
I
got-
can work on the muscle, but the skin is
It's about the
we've got
skin.
all this. So how are we going to get before and after pictures of it? You've
I'm going
got
to take them.
Yeah, fantastic.
Yeah.
Okay.
Absolutely. It's exciting.
Right. Tell me why you inject these particular points.
So it's a mixture of heavy and light chains as well.
Okay.
It's not a volumizer,
No.
but it's amazing to create more of an airbrushed look, helps with skin laxity, it biostimulates the skin,
Yes.
it produces different types of collagen. That's the
Fantastic.
main thing.
Just by having that sort of super hydrated state in the skin, it really remodels itself, doesn't it? Yeah,
absolutely.
Wow,
So
okay.
the way they formulated this is that there'll be 0.3 mils per point,
Okay.
10 points again.
And then does it spread under
Yeah.
the skin in the way that it does in the face? Okay.
Absolutely.
Great. Tiny injection. That's fine. Belatedly, I was thinking, is this going to hurt? Answer is barely. I'm very curious, so I will put up with quite a lot pain-wise, but I mean, this is just
It's not bad, is it?
minor, very minor discomfort. Tiny lumpy bumps. I've forgotten that. With Profhilo on the face, you go home looking like you've got these alien wasp stings. So I'm going to have alien arms for the rest of the afternoon. But these will go down pretty quickly, won't they? I mean, they'll be gone by tomorrow morning.
Yeah, you've got a little bruise there.
Okay.
Apologies.
See, this is going to cover it up and just keep it sterile.
And it has arnica in there as well.
And arnica, lovely. Fantastic.
There we go.
Thank you. And how long do I keep that on for?
A few hours.
Okay.
And there'll be a couple of spares to give you as well.
Thank you. How long until you start to see results? Is it a couple of months after first treatment?
Yeah, so it's a few weeks after the second usually.
Okay, so I'll be looking fab by Christmas.
Absolutely.
Preema, thank you. Look, I got my badges of honour. It's really exciting to try such a new treatment. So thank you. What an amazing clinic.
No, thank you so much for coming here today.